Right, good afternoon. I'm Derek Brook, Chair of the Executive Committee. Welcome to this afternoon's meeting of Barrow Borough Council's Executive. Just got a few formalities to say before we get onto the exciting business. It's important that all members conduct themselves in an appropriate manner, and please get your mobile phones on silent. If any member or officer wishes to speak, please raise your hand through the facilities on the Zoom. And if you're not speaking, please mute yourself so that we don't get all that noise in the background. If members do lose a connection, we will adjourn for 10 minutes. So if there's a stop in the meeting, we apologise to anybody who's watching. I would remind you all, it's being streamed live on the council's YouTube channel, so people can access this. So I have heard of one or two weird things happening on these that nationally we've been okay, but if you're going to go for a bath or a shower, it's probably better to wait till after the meeting. And to vote on matters, I'll ask Democratic Services to manage the process. And at that point, unmute your microphones. We'll need a mover or seconder, and a roll call will be undertaken. So that's the formalities. So we're going to get on with it. So can Democratic Services undertake a roll call of members present, please?
Okay, so could you say present for members and also officers? Councillor Barlow.
Present.
Biggins.
Present.
Blizzard. Councillor Blizzard.
Present.
Councillor Brook.
Present.
I've got apologies from Councillor Hazel Edwards, Councillor Hall.
Present.
And Councillor Hall is substituting for Councillor Edwards today. Councillor Hamilton.
Present.
Councillor McClure.
Present.
Councillor Maddox.
Present.
Councillor Morgan.
Present.
Councillor Pemberton.
Present.
Councillor Roberts.
Present.
Councillor Ronson.
Present.
And we've got officers in attendance. Chief Executive.
Present.
Director Resources.
Present.
Director of People and Place.
Present.
Debbie Storr.
Present.
Sandra Baines.
Present.
Jason Hipkiss. Jason Hipkiss.
Present.
Thank you. Jenny Sharp.
Present.
Caroline Wagstaff.
Present.
And Colin Cox.
Present.
Thank you very much.
Right, are we on to item 2? To start off the meeting before we deal with all the minutes and all that other stuff. Well, I'm glad to welcome Colin Cox, Director of Public Health, to the meeting to give us a presentation about what's going on in these strange times. And if he gives us a presentation and then leave your questions until after the presentation, I think is best. So over to you, Colin. It's all yours.
Well, thank you very much, Chairman, and I'm very glad to be here in a virtual Barrow to talk to you about the COVID-19 local response. What I want to do today, if I may, is start off briefly by talking a little bit about where we're at in the national epidemic, where we're at in the local epidemic. I'm then going to touch on the vexed question of whether Barrow is some form of outlier in all of this, because I'm sure members will have been very aware of some of the conversations that have been going on about that and the discussions around that over previous months. And then I'm going to say a little bit about where we're at in terms of the local test and trace system, which is so crucial to the next phase of the response. And happy to take any comments or questions on any matters at all related to this from members. So if I start off with the national picture, and I do apologise that there are going to be quite a few graphs and stats in some of this as we move through it, but it is a bit difficult to describe some of this without sharing some of these with you. So hopefully they will help to make things clearer rather than more confusing. This graph shows UK deaths from COVID-19 by the date that they were reported rather than the date that they actually happened. And so you can see fairly clearly from that from the early part of March, there was a very steep rise in the number of deaths through till the early part of April. And since then, we've been on a much slower decline in the death rate associated with COVID-19, to a point now where it's relatively stable, just declining, but much more slowly. If you're confused by the sort of peaks and troughs in this, it's because of the date reporting. Quite often things are not reported over the weekends, which is why you see that pattern of drops off for 2 days in a row on a regular basis. But the black line is a rolling average, and so it very much shows what the pattern of mortality has been across the country as a whole. In Cumbria, we have followed very much the same sort of pattern. And this is not moving on as fast as I thought it was going to, apologies. COVID-19 deaths on a daily basis in Cumbria. Again, the registrar's data that we've got is shown in the red bars there, and the green line is the 7-day rolling average. Again, what you can see here is this initial peak in cases that peaks at about the same sort of time as the England average does, drops down again. There is a small secondary peak around about the beginning of May. This is much more associated with care homes, whereas the earlier peak was associated with hospitals. And we have now dropped down to a level where it's very low, very stable, usually 0, 1 or 2 deaths per day at the moment. So that takes us to about 429 deaths to the 26th of June. There will have been 1 or 2 more since then, but at very low levels. And that's a significant number of deaths to have occurred in Cumbria over this time. However, I just wanted to put it in a little bit of context. The red bars at the bottom there are the same data, and the green line is the same data as from the previous graph. The yellow curve is what right at the very beginning of this we were told might happen if we didn't take action. That is the roughly 80% of people catching it and 1% of them dying. The yellow curve would have been where we were at. So while 430 deaths is 430 too many, it is significantly better than anything that we were originally planning for. So indicating very much the success of some of the strategies that were put in place, particularly the lockdown measures. Now, members I know will be very aware that back in May, when district-based rates for infection were published, there was a very significant interest in Barrow, as its rate of positive cases appeared to be twice the rate of the second highest in the country. So there's been a lot of conversation about whether Barrow is some form of outlier in all of this, and whether Barrow has been hit particularly badly. And there's been a lot of work done recently by myself and Public Health England to try and dig through some of the statistics and understand what's been going on in Barrow. And I know that Public Health England are just about to publish and share a document that they've done that tries to summarise some of where they've got up to in the thinking about this. But I'll just share a couple of statistics with you again, just to give you an indication of this. Apologies, this is a data-heavy table, but I'll talk you through it. The columns, the first couple of columns here, so March to May 2020, so that's a 3-month period of death. You can see that COVID-19 related deaths in the period March to May, Barrow-in-Furness had 104 deaths per 100,000 population, compared to Cumbria's 79 and England's 82 deaths per 100,000 population. So in that, it starts to look initially as if perhaps there has been a bit of a challenge in Barrow. But the reason I'm focusing on deaths here is that they're very much more able to be measured. When you're measuring positive cases, you start to get into all sorts of challenges around the rate of testing that's being done, and I will come back onto that. What that shows you, when you look at the the extent to which Barrow is higher than England. You see that if England has an average of 100, you make it a ratio, Barrow is 27% higher than England, whereas Cumbria is at 96% of the England figure, so slightly lower than the England average. So again, it rather looks as if Barrow might have had been significantly more badly hit than Cumbria and England as a whole. However, it's really important to note the final column in this graph, which shows you that actually if you take before COVID and you look at mortality from causes considered preventable over the 3 years, 2016 to 2018, which is the latest data that we have available to us for this, that Barrow's rate of mortality from all causes considered preventable was also very much higher than England's average and than Cumbria's average. And in fact, this is the pattern that we're seeing across the board, across the whole country, really, that there are places that look as if they're more badly hit. And that's associated very significantly with levels of deprivation and previously existing poor health conditions. And so, in fact, while those areas of deprivation look as if they're much more badly hit by COVID-19, actually it's not much different in terms of the increase that they see compared to their rate of mortality from other factors overall. So yes, more badly hit, but then Barrow, as we all know, has been more badly hit by heart disease, by respiratory conditions, by cancers, and effectively by all causes for quite some time. So what COVID-19 is doing here, I think, is not demonstrating that that Barrow has been particularly badly hit within an English context, but what it's doing is drawing attention to the significant health inequalities that have already existed both within Cumbria and in the wider country. But be that as it may, those figures around testing were dramatic. And so the question is, what explains some of those? And this is a graph from the Public Health England document that's going to be released shortly. It's a number of people tested per 10,000 population in Barrow compared to a number of other areas. And you see here that this big bar here, the blue bar is Barrow. Cumbria is the pale grey bar, and a number of other areas, England, Lancashire, and the Northwest average in the darker colours there. So what you see in this is very clearly a substantial rate of testing going on in Barrow relatively early in the epidemic. And in many ways, you would therefore expect to see that there would be a higher number of cases testing positive, particularly if you're testing the right people. And again, this is a complex set of charts, so I'll talk through it. This is each large areas of Northwest Cumbria and Lancs, Cumbria, each of the boroughs and districts in Cumbria, and compared with a number with Lancashire and others. So this grouping here is Barrow. The top row is younger people aged 0 to 19. The middle row is 20 to 64 years, and the bottom row is 65-year plus, with the red being men, red being all people testing positive, the green bar being men and the grey bar being women. And what absolutely jumps out at you from this graph is the number of people being tested positive in Barrow of a working age, and particularly that very, very substantial number of women testing positive at working age. And this is one of the factors that really starts to demonstrate that what was happening with the testing that was going on in Barrow was a very substantial amount of testing being done by Morecambe Bay Trust around about the hospital. They were testing hospital workers and family of hospital workers very early and quite aggressively to try and support their staff. Very commendable of them for doing that. And so you were starting to see the rate of positive tests very much in this working age female population. Indeed, at one point, almost pretty much half of the positive tests in Barrow were coming from Morecambe Bay staff. So I think that it's fairly clear from some of these that the question of whether Barrow is an outlier is one that's been difficult to dig into, but a lot of it is statistical anomaly that is based on the amount of testing that's been done. And where Barrow has actually been more badly hit, it's not been any more badly hit than you would expect it to be, given the levels of deprivation that you see. So at the moment, that's what it's looking like. Not a particular problem going on with Barrow, despite what you may have read in the press or some parts of the press at particular times towards the end of May and into early June. So now that we are coming to a phase of this epidemic where we've got a relatively low number of cases being detected positive across the board, and very few deaths, what starts to happen is, rather than there being an overall epidemic picture that you see across the whole country, you start to see the epidemic breaking down into various different bits. So you start to see a low level, consistent community transmission of the virus with some substantial outbreaks that go on throughout the course of the next several months. And we have seen some of those outbreaks, not yet in Cumbria, to the extent they have happened elsewhere, but I'm sure people will be familiar with there's been a chicken processing plant in Anglesey recently. Obviously, Leicester has got a much more substantial area-wide problem with its outbreaks going on. And indeed, our neighbours in Dumfries and Galloway have recently just contained a small outbreak, the first of the outbreaks north of the border. Now, in order to deal with that, and how you start to release the lockdown measures that we've got in place safely, you need to have a way of identifying outbreaks quickly and responding to them. And by responding to them, you mean finding out who might have been exposed and getting those people to isolate, so you break the chain of infection that's going on, and you prevent the spread going further, and therefore try to prevent things moving into the second wave of infections, which everybody is so concerned about. So we have a test and trace system in place. The national system, the vision for it was to be an integrated and world-class test and trace service, so that we can control the virus and help people lead a safer and more normal life, with several strands on that. Testing, rapid testing, integrated contact tracing, using local data to manage outbreaks and flare-ups at a local and national level. And then the final strand of this is about learning more about the way the virus operates. And very much so we have testing at a national scale and a local scale. We have tracing at a local scale and a national scale. And then the outbreak management is very much a local and regional response. As part of that, there's been a very substantial shift in emphasis from national planning and national response towards the local response. And that's absolutely the right thing to happen in these situations. It's difficult for the national government to manage outbreaks at a local level. That's very much where the local agencies come in and can really play their part. So we've been asked to produce a local outbreak control plan, 7 key themes, which you can see there. The requirement was for us to publish this plan by the 1st of this month, which we have done. You can find that on the County Council's website. But within this, it's really setting out what we're doing and how we are working to do our own local contact tracing, our own local testing, and our own management of local outbreaks. Our plan has got 2 major parts. Firstly, one is an overview, strategy and governance that I think many people will be interested in seeing how we're going to be working. Part 2 is a much more detailed operational response, probably not hugely interesting for the wider public because there's a lot of and a lot of very distinct details about what people will need to do under certain circumstances. But certainly the overview and strategy bit of it is potentially interesting for the wider public. We have opened that for consultation. We are working to this plan as we stand, but we know we can improve it. So we've got till the end of this month for people to feed back on it so we can improve our response. Part 3 of the plan just sets out some of the contact details for key settings so that we've got them all to hand. That's not going to be published, but it is being finalised and pulled together now. And just to talk you through very, very briefly, I'm not going to go through this in a lot of detail. We can circulate these slides for members afterwards. Our local test and trace system really hinges on a couple of key things. We have an integrated data system, which is accessible both by ourselves in Public Health, but also by Public Health England and by district councils and by contact tracing teams. But it's very much at the heart of this, you see district council environmental health teams. They are the incident response leads when we become aware of anything that might become an outbreak or anything that we identify as an outbreak. It's very much the district environmental health teams who take control of that, who respond to the incident locally, draw in local testing if that's what's required, try to access national testing if that's what's required, link with our contact tracing team, which is in the Sexual Health Service, to make sure that we are identifying everybody who's a potential contact. And I have to say that the district environmental health teams have been absolutely phenomenal in all of this, including in Barrow. The support that they've offered into this system has been second to none. And they're absolutely essential within all of this. So as we now move into a time when we are, many people are starting to try and get back to normal, and I know that environmental health teams are starting to get busier in their maintaining their routine work. Alongside the national requirement to produce a plan about this, there was a £300 million budget associated with it for the implementation of that plan. Cumbria's proportion of that is about £1.7 million, and there are ongoing conversations about how that is best to be allocated. And I'm very much seeing environmental health teams as being one of the bits of the system that is going to require funding to enable it to continue to perform this function for the longer term. Just so you're aware, on this graph, the arrows are coloured according to the bits that are working well or less well. So the green lines, which is effectively all the local stuff, is working pretty well. The orange lines need a bit more work. And I've got some concerns and challenges around the red lines, including how we are actually accessing the national data from contact tracing, which we're now getting to a postcode level, which is helpful, but it's not as helpful for outbreak management as it could be. We are actually going to need to start getting individual results from national testing and contact tracing if we're going to manage this as effectively as we should. But overall, the system is working very well with a lot of support from a wide number of areas, including, as I say, district council environmental health teams. This system has been, as I say, working up to the 30th of June, when it was launched properly on the 1st of June. We identified 139 index cases. Those are people who have tested positive for the first time. We've traced 239 contacts of those cases, given them advice about self-isolating so that we can break that chain of infection. Our incident management hub, which incorporates environmental health staff from across the county, plus ourselves, plus Public Health England, identified in that first month 30 incidents, of which most, I have to say, were symptomatic teachers or pupils in schools who were then tested and found to be negative, so they never came out as outbreaks. But very much addressed those, supported schools to access testing and support, and then managed to, once they were able to close those incidents down. At that point, incidents actively being, and we were down to outbreaks. very substantial amount of work that's been going on to manage the spread of infection throughout Cumbria and try to contain that where we can. I think that's it in terms of what I wanted to share with everybody, Chair. So I'll hand back over to yourself for comments and questions.
Right, thanks very much, Colin. I'm glad to see that we didn't reach the top of that graph that was about the second or third one with the big thing on it. At least we never got up there. So has anybody got any questions? Should we have somewhere? Now then. Lee?
Thanks, Chair. Thanks, Colin. You covered everything I hoped you would with historically and where we are now. I've got a few points. Can I just run through them and you can pick and choose? It's mainly observations to see what you think we could do to maybe make sure we're covering all these sort of possibilities and threats we might have to the area. So, for example, for testing, is it still true that the testing is only done on people with symptoms? So if you shouldn't be going to obtain a test if you don't have symptoms, because I'm very aware we're not sort of pursuing the infection rate. We're really sort of waiting to. So for example, asymptomatic people won't be picked up on the testing. For isolate, from your work up to now, do you think businesses have been cooperating enough to share their data and make sure they're collecting data at the point of use? And do we need to improve our public comms to make sure people are comfortable giving their data to businesses? When major employees are starting their own testing regimes, that could increase your workload either locally or from your department or our own. Do you expect that to be a significant increase? For example, major employers will be routinely testing their staff. It won't be by symptomatic people. So, and that could be quite a steady rate increase over the next few months. From the analysis of the data, you said that, for example, people in deprived areas were more vulnerable to experiencing more serious health conditions. Do we need to use that data to make sure we are protecting the right vulnerable? In our terms of vulnerable, the correct term, do we need to alter the sort of people we're protecting based on the lessons we're learning from people who are becoming more seriously ill? Because at the moment, we're just using quite a broad sort of spectrum of you're vulnerable because you've got these conditions. So is there anything different from the data that we've had here? I know there's a few, sorry, but the thing is, the R number's not been mentioned as much now where it was before. Do you have an opinion on use of the R number, either locally or nationally? Because it seems to have dropped off the scale, but I think that from previous media, that seems to be quite important. And my last one for now, you said as well that the testing, I completely agree with you about the testing rates. It made it impossible for us to compare ourselves with the other areas. But again, from a lessons learned point of view, and I'm keen to see this updated analysis of our data we were promised. If you're saying a lot of the infection was from hospital workers or healthcare workers and their families, do we need to learn a lesson from that as well, of the amount of PPE or the level of PPE they've been using relative to their occupations? Because the fact we're testing people on the front line might actually give us a bit of a warning what might come if we do get a spike. Obviously, they're going to be entering the hospitals and the care and the healthcare facilities again. So you have a concern that may be replicated, which would, at the very least, restrict our ability to respond, because it would mean healthcare staff would have to be isolated. And that'll do for now. Thanks.
Okay, thank you. I've tried to make a note of some of those, so I'll try and make sure I've covered them all. Do tell me if I'm not covering things as well as you would like. So the first one was about testing asymptomatic people. yes, in most cases, that's right. If you're a contact but asymptomatic, we wouldn't normally test you, and we would then test if you became symptomatic. But if you're a contact, you should be self-isolating anyway. So the chain of infection has therefore been broken. There are occasions when you would test asymptomatic people, in particular in the potential of an outbreak situation, where you may want to, in a workplace, for example, you may want to do much more widespread testing, or a care home, you might want to do much more widespread testing to try and identify people who may be asymptomatic but still spreading it. But for most people, if you're identified as a contact but you're asymptomatic, you won't be tested. That's right. In terms of isolation, I think the question was about whether employers were doing enough and giving us the right sort of information that we needed. I mean, obviously, there have been people that we've been working with for quite some time on this, including major employers such as BAE and Sellafield. And we've been working very closely with them. And so certainly feel that they are supporting this process as much as they can do. Other employers, the challenge will be around things like pubs, restaurants, but of course they only opened just at the weekend. So it's a bit too early to tell on some of that. But I know that certainly for them, the intention has been that they should be recording people who turn up. And I know that there's been a couple of examples, not in Cumbria, of pubs who were open at a weekend who've then had to close down again because they found that there were people who were COVID positive had been there. So I know that is happening, but it's much more part of the national system at the moment. In terms of testing and major employers doing their own testing regime, obviously there are a couple of those. BAE and Sellafield again have instigated some of those. And to be honest, I think that's probably it's for them to make the decision as to whether they're wanting to do that. Clearly, when you say it might increase our workload, yes, only if they test people if they find people testing positive. And I would rather they found them early and increased our workload than that there was an outbreak and we didn't spot it for a couple of weeks or whatever it might be. So I think when you have people in that potential situation and a big employer can afford to do that, I don't have a problem with that in any way, shape or form. In terms of vulnerabilities, that's an interesting question because you're absolutely right that the people that we were targeting were based on a number of conditions that people have. And those conditions will be right, there's no question. But there may be others. So we went into this epidemic seeing COVID-19 as a respiratory infection. And it is a respiratory infection. But actually, it's not the people who've got COPD and severe asthma who seem to be suffering most from it. They don't seem to be at all that much higher risk. At much higher risk are people who suffer from coronary heart disease, diabetes, and who are obese. So actually, one of the major ways in which COVID-19 kills is not through respiratory routes, but through cardiac routes. And so the question then is, should we be at least warning people even more? And I think there's an element of that we probably need to be alerting people even more to that particular vulnerability. And that's very much, I suspect, one of the reasons why more deprived areas get more badly hit, because they have more people who have got coronary heart disease as a general rule. And so I suspect that's not a coincidence. The R number you picked up on, it's still important as a concept, but at small levels, small area geographies, and particularly when there's not that many cases, it becomes relatively meaningless. So at the moment, Cumbria in the last 7 days or so had about 25 people testing positive in total. And you can't calculate a meaningful R from that sort of level of data. So it really only works at a much larger, particularly at this phase of the epidemic. And then testing in hospitals, I think we've learned an enormous amount in hospitals. And I think in the inquiries that will inevitably follow COVID-19, one of the things that I suspect will get picked up is that as a system as a whole, as a country as a whole, that not quite recognizing the extent to which COVID-19 is a healthcare associated infection is probably going to be one of the lessons that gets learnt. And so I think that we probably have learned something very serious about PPE and the infection prevention systems within hospitals, which I'm sure improved substantially after some of those early days of the epidemic. I hope that covers everything you were looking for.
Right. Councillor Hall next, and then Councillor Pemberton.
Okay. Hi, Colin. Thank you for that. It's very interesting. I know King's College and some other places are doing some studies on antibody testing with the public. I've got a few friends who've been sent the packs, prick your finger, send some blood back. Is there any sort of feedback coming from that yet? Because an antibody testing has been a problem, hasn't it?
Yeah, there's a range of antibody testing studies being done, including one that is a kind of general population seroprevalence study, which is probably the one that you're referring to.
Yeah.
But it's also now being rolled out across much broader levels of the health service and into the care sector as well. And what we're seeing from the latter is that you've got a fairly significant number of people within the health and care sector. You're probably looking at the sort of 10 to 14% margin who might have who are testing positive for antibodies. Lower in the general population, probably looking at something more like 3 to 4%, maybe up to 5%. So we'll be continuing with this and obviously learning more about it as we come through. But it does look as if the general population has not been widely exposed to COVID-19. Now, in a way, that's a good thing. That tells you that lockdown largely worked. It was a successful strategy in containing the spread of the virus. It does mean that one of the challenges with the antibody testing is we don't yet know what that tells us about whether people are immune to it in future. But it does mean that we've still got 95% of the population who have not had an exposure to it and therefore may well get it again, even if the 5% are immune. And so the risk of a second wave of infections remains very real. And that's one of the things that sort of antibody testing is telling us.
Right. And the other quick one I wanted to ask was around when the virus first appeared. I've been reading some stuff around it's been found in sewage before the outbreaks. The outbreaks have gone back, haven't they? A lot of people seem to suffer with this chest virus infection earlier this year, and this is perhaps leading. Is it that was the start of coronavirus, or?
I've read those articles as well. I don't know the truth of them. I have to confess, Councillor Hall. The standard narrative is that we saw this being announced at the end of December in 2019. It may well have been circulating a bit before that, but I don't know. I think given what we've seen in terms of the way it has affected places once it's got hold, and you saw the rapid rise in cases in the graph that I showed you at the beginning of the presentation, I would be surprised if we'd just missed it circulating any earlier. But I don't know. And again, there's a lot of research going on to find out more about that.
Yeah. No, thank you very much.
Okay, Councillor Pemberton, hang on. Alan, unmute yourself, Alan. Whoops.
Right. Is that right?
Yeah.
Yeah, can you hear you now?
Technology. Thanks, Colin. I'm a bit of a skeptic, really. And there's an old saying, lies, damn lies on statistics, which I often refer to. Barrow, we're often shown in a bad light by national statistics, which do not take all the facts into consideration. And the fact that our hospital, I believe, was delegated as the hospital to deal with all the corona cases in the Morecambe Bay Trust. The calculation should have been made using the whole of the people covered by that trust and not just the 67,000 people in the Barrow area. This obviously made the result detrimental to the town, while at the same time forcing many Barrow people to travel to Kendal and Lancaster for checkups and minor operations that they would normally have had at their local Furness General Hospital. Is that right, or am I missing something there?
No, I mean, it's certainly right that people who are COVID positive were going to Barrow, and Kendal was being identified as an area where you would not be taking COVID patients. So I think there were people who were probably diverted to Kendal who would normally have gone to Barrow. So I think that's absolutely right. But I think your point about interpreting the statistics and understanding everything that's going on about them before deciding what's actually happened is absolutely right. Because if you don't see the full picture and what the statistics are actually telling you, then you're going to come to the wrong sort of conclusion. I mean, it's very notable that that first week when Barrow was identified as that massive local hotspot, it was the top of the league table, if you like. Second on the league table was Lancaster, and third on the league table was South Lakes. So the three areas that were all served by the trust, by Morecambe Bay Trust. And so all three of them were experiencing similar sort of things. For similar sort of reasons. So you do have to understand what's going on to interpret the statistics effectively. You're absolutely right.
Thank you, Tom. Thank you, Chair.
Right, have we got anybody else?
Councillor Blessard, Chair.
Oh, sure.
Yeah, me, Councillor Brooke. Yeah, could I just ask, what is the shielding group, is that definitely ending at the end of July? Is there any difference locally, or is it still the same nationally? A lot of people, my residents that have asked me, just seem a little bit confused about what they should be shielding still or not. So I just wonder if you could give anyone any advice on that, please, Colin.
No, there's no difference locally between local guidance and national guidance. So the national guidance is easing the shielding recommendations, again, trying to do it carefully and slowly so we don't make things substantially worse. So people who have been advised to stay at home are now being told that they can start to go out, but that they should be very careful when they're doing so and make sure that they are absolutely following the physical distancing guidelines and trying to remain more than 2 meters apart, and recommendations about protective equipment and things like that are still there. It's a difficult balance to strike because clearly people become slightly more at risk if they go out and when the virus is still circulating. But on the other hand, we know that the impact that being so isolated has had on people has also been very, very negative. So the shielding, it's important to note, is guidance. It's not a rule. So if people are uncomfortable going out, they can stay in. And if people are comfortable going out more than they're being advised to, they can do that too. But they're being given the advice as to where the public health establishment thinks that the balance is probably right.
Excellent. Thank you.
Thank you. Have we got any more? I can't see any.
Councillor Roberts, Chair.
Right. Go on then, Lee.
I know I've had my bit, but just one final one. I just want to see if anyone else mentioned it. In your presentation, one of the things you said was a concern of yours, your red arrows on your table, which has been a concern all along, is the availability and how live it is of the local data that you're relying on national data collection to provide to you. How do you see that unfolding? Because I think that's essential, is if to control, as you said, any local spikes or outbreaks, and how you react to them. We won't want to see a Leicester-like situation where a small local outbreak results in a quite widespread down that will affect businesses on a wider scale. So I see your concerns would actually hamper you from doing your job. So can you just elaborate a bit on where you think that's heading, how quick that be resolved, and can we as a council do anything to help you put some pressure or ask some questions for you to help resolve that matter?
I suspect that we will start to get that information. It's becoming ever more clear that it's important for local areas to be able to have that. You know, I said earlier that we, in the last 7 days, Cumbria had about 25 cases testing positive in total. If you were to say to me, how confident are you that in every single one of those cases, you've managed to trace all the contacts and get them isolated and stop the chain of infection? I would be confident where we've done the contact tracing, but I would have no idea where it had been done through the national routes. And that is a concern for me. And we are reiterating that when we talk to Government Department of Health on a regular and routine basis. And I think they're hearing the message. But certainly it doesn't do any harm for other people to be reiterating that message about the importance of sharing the national data with us at a local level.
Anybody else? Can't see anybody else's hand up. Right, thank you very much, Colin. That was very useful and interesting, and it saved you having to come down the motorway as well. So thanks very much for coming. And I hope, I mean, once all this is out of the way, I mean, we have got a report coming up now about how we've, dealt with the crisis locally and how we plan to go ahead. And we certainly need to do something about these health inequalities. So we'll no doubt invite you back at a later date, hopefully in person, but if not, another one of these.
Yep.
And,
very happy to do so, Chair.
Thanks very much for coming, and you're welcome to watch the rest on YouTube if you've got nothing else to do. Double our figures of watchers.
Thank you very much. I'll maybe get away and do other things. Thank you very much.
Okay, thanks very much.
Thanks, everybody.
Thank you. Right, now then, on to the other stuff. Let's have a look. Urgent items. Agenda item 3, urgent items. We haven't got any. Correct. Delegations. Does any member wish to move any delegated matter to be non-delegated? No. Admission of public and press. Well, they're not here. Should they be excluded? I suppose we can go private in any of these. Can we? Is there any items on here that we want to close YouTube for? No. Declarations of interest, anyone? No. Right, confirmation of the minutes. Can we agree the minutes of the meeting held on the 3rd of June?
Agreed.
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 Right, I'll sign them when, apparently at some point, when there's real paper and pens and ink and all that stuff. Item 8, public participation. We haven't had any requests for public participation. Item 9, terms of reference. Do you agree to note the revised terms of reference that are attached in the agenda?
Agreed.
Yes?
Agreed.
Oh, right. Agenda item 10. Would Sam Plum, our Chief Executive, please present the report on growing forward our response to COVID? Please.
Thank you, Chair. I will do that. It's quite a lengthy report. I'm going to assume that you've all had a chance to read it and digest it, but I'll spend about 5 or 10 minutes just pulling out some of the main points in the report, and then open it up for questions, and then Chair can take us through the recommendations. So I'm not going to dwell really on how the council responded to the global pandemic and the emergency. I think that is now documented in the report and it's now therefore on public record. But I do want to just thank everyone, staff, councillors, businesses, our residents, for everything that they did to protect and support our borough. And I think we probably do need to take a minute to thank people for that. In terms of our response as a council, there's a lot of detail in there as to all the things that we did, and we were keeping members up to date on everything that we were doing as it was going on. But I just really wanted to remind you about a piece of work that we did about 18 months ago, where we agreed a set of values and behaviours for the council. And they are being community focused, so absolutely putting our residents at the heart of everything we do, acting with honesty and integrity, working as one team across all services, aiming high and being proud. And I think they were really encapsulated in our response to coronavirus and the way that the council worked, and the way that the officers in all sorts of different services were incredibly flexible and worked in really different ways at really short notice, quite often over really long hours, to do what we needed to do to protect and support our residents, but also to keep services running and to support our businesses. So I just want to pick out three of the huge range of activities that are in that report that really encapsulate those values and behaviours, and really make me proud to be your chief exec. And those are the way that we've responded to our local communities and the need to really support vulnerable people, and the work that the Barrow Community Local Resilience Forum did very, very quickly to set up a call centre and a system with delivery hubs across the borough that really got out supplies, services, medication, support in all sorts of different levels to our most vulnerable residents incredibly quickly. Was just amazing, and I think that's something that we really need to shout about. I think it seems like a distant memory now, but I think the way that a whole range of different parts of the council and partners came together to turn Furness Academy into a recovery centre over the space of a weekend was just an amazing amount of work. Thankfully, we didn't need it, but when we needed to actually put the hours in and get that piece of work done, we did it. And again, I think that's something we need to be proud of. And the way that we worked with various different parts of the council to get those businesses out, grants out to businesses as quickly as we did. I know we had a few hiccups at the start, which was basically because of the impact that our own staff had as a result of coronavirus, and us having cases and us having to isolate, and the way that other parts of the council reacted and responded to that and picked up that work and delivered it, again, is something that I'm really proud of. So there's all sorts of different examples in that report, but I think they're the ones that really speak to me as to how we can react at pace and with compassion when we need to really work together as one team and deliver what we need to do for our residents. So moving on to growing forward, I think Colin's presentation is really important to think about that. We can't forget the impact that this virus has had and will continue to have on our communities. And I think we do need to remain vigilant. I think we need to really make sure that we are keeping vigilant and that none of us become a contact by being in the wrong place at the wrong time and not maintaining social distancing and washing our hands and doing all the other things that we all know that we need to do. But I also think that we do need to give ourselves some time and some support for our communities to grieve and heal. We have lost over 60 people, and I think we need to give ourselves some space to think about that impact on our communities and our residents and how we move forward from that. One of the things Colin just said, actually, when he was talking about our death rates, is that they are high, but they're not higher than expected given our levels of deprivation. And again, I think that's something that coronavirus has really brought to the fore and put a spotlight on, is that when you've got high levels of deprivation and inequality and poverty in a place like Barrow, then something like coronavirus really exploits that and makes it worse than it is in other areas. So I think one of the things that it's really that a lot of different people from different organisations and councillors I know that are on the exec now have been talking about over the last few months is that we can't go back to normal, because actually the way that we used to do things didn't work for a lot of our residents. We did have high levels of inequality, we do have high levels of poverty, and that actually the way that we delivered services and the way that we worked wasn't addressing that, and it was getting worse instead of better. And actually we can't go back to normal, and we need to think about working in a really different way that really puts our residents at the heart of what we do and gives them the ability to thrive and reach their full potential. So one of the things I think we really need to do now as an organisation with our partners is think about how we work and how we grow forward in a different way than how we've worked in the past. And I think the values and behaviours and qualities that have got us through the last 4 months in terms of looking out for each other and working as one team and being compassionate and being caring and being kind are absolutely central to how we need to reimagine the way that we work in the future and how we take our borough forward. So one of the things that the report sets out to do is shows how we can start to achieve that using the 3 priorities that we've already got through our council plan. So our council plan was agreed in January. Those 3 priorities around our people and our place and our prosperity are still really important. They're still our priorities. I don't think anything's shifted from that. But I think one of the things that coronavirus has enabled us to do is really think about what the priorities are and where we might need to refocus some of our efforts. And some of that is around tackling those inequalities and that poverty that I've already mentioned. And I think we also need to think about that in terms of secondary impact. So we know that the virus itself has had a disproportionate impact on our more deprived communities, but we also we believe that there will be significant secondary impacts on our borough and across the country. And, you know, Chancellor's given a statement earlier today outlining how we can start to recover and some of the safety nets that we need to put in place to really try to ward off a huge economic recession, which is being predicted by economists now. And I think we won't know the full extent of the impact of lockdown on our economy for some months yet, but we need to be vigilant about that, and we need to do all we can now to try and protect our borough and our residents from that secondary impact. So for our people, for our residents, I think the plan sets out how we can really build on the new and the existing partnerships to really focus on helping residents to help themselves and help residents to realise their aspirations and reach their full potential. And I think we need to put more effort and renewed effort into those partnerships and really strengthen some of that joint working and work as one team for our borough. I think we need to think about healthy lifestyle and lifestyle choices and really looking at those health inequalities and how we can help our residents to be healthier than they are now. And again, picking up those points that Colin just made about the fact that heart disease, diabetes and obesity are all issues that have significantly impacted on people from coronavirus. They're all things that can be treated or can be prevented through lifestyle choices. And I think that's something, again, that we really need to promote. One of the fantastic things about coronavirus actually during lockdown was that when we were all asked to, or told that we could take 1 hour's exercise a day, a lot of people did. More people did than would usually exercise for an hour every day. Walking and cycling has increased. I think Halfords was one of the busiest online businesses in the country because everybody wanted to get out on a bike. And I think that all those things around exercise and walking and some of the other things that we know that we can do, access to good quality, affordable locally grown food. There's all sorts of things that we can do to enable people to make healthy lifestyle choices, and that's something that we really need to prioritise. And I think the other thing around our people is around feeling safe. We know, again, from coronavirus that anxiety levels and mental health issues are high and rising, and that manifests itself in all sorts of different ways. I think one of the ways that it has manifested itself across the country, but also in Barrow, is around community cohesion and that tension that flares up between. And I think that, again, that's something that we need to recognise and address, and also in terms of safeguarding and the pressures on children and families in the last few months, but also going forward as those economic impacts really start to hit us come October when furlough finishes. So I think there are some real things that we need to do around there. And the one that's probably at the forefront of my mind at the moment is school holidays and how we support children and families as we go into school holidays, especially for children and families that have been out of school now since March and then not going to go back into school until September. That puts all sorts of stresses and strains on families in all sorts of different ways. And I think it's something that we really need to to get our head around. And there's a lot of work already going on with a range of organisations to see how we can support our children and families through the summer and into autumn and winter. In terms of our place, I think, again, one of the things that's been highlighted through the last 4 months is the fact that we all know this anyway, that, you know, Barrow's got a lot of terrace properties, people don't have access to gardens. We do have an issue with inclusion around digital, where there's a number of families that don't have access to Wi-Fi or the software or the hardware that they need, and that's, you know, something that we really need to think about going forward. So we do need to prioritise getting a housing strategy for the borough that makes sure that we are enabling everybody to live in a decent home that they can afford to live in. Homelessness, again, has been put into the spotlight, and we need to support our homelessness team to continue to support our most vulnerable residents. We need renewed energy into our clean and green agenda. So there's been all sorts of issues around fly tipping, and, you know, some of our beautiful places have been fly tipped and it looks awful, and we need to really work with residents and others to educate people. But if that doesn't work, then to do more enforcement and really be tough with people who don't treat our environment with respect. And the other thing around the environment is our climate action plan. So that came to the last exec, and I think it's important that we really press ahead with that, and don't forget that we've also got another global emergency, which is climate change, and these two things need to go hand in hand. We need to make the most of our amazing assets, both natural and built, and we need to really focus on sport and culture and leisure and give people opportunities to experience different things. And again, one of the things that at the front of my mind at the moment is a future High Street Fund bid, which has got to be in about 3 weeks' time. So I think that's, you know, a big plank of how we look at our town centres and re-energising our town centres. In terms of our prosperity, as I've said, we don't know the full impact yet of coronavirus on our economy. I think that's something we really need to watch and be mindful of. But I think we also need to continue to be ambitious and to develop our own story and our narrative, and be involved in those at a strategic level, on a bigger footprint than just Barrow, to make sure that we attract the investment and the jobs that are really going to benefit our residents. So we're continuing to work at a county level through the LEP. We're continuing to work with the 3 district councils around the Bay, and we've got our first joint committee for the Morecambe Bay area towards the end of this month. Our Brilliant Barrow bid, which is our Towns deal, again will be submitted to government in about 3 weeks' time, which should secure another £25 million to help us really drive forward some of our ambition in a range of fantastic projects. We do need affordable, accessible digital hardware and software so that our children and our workforce take opportunities of the different ways that we're working now. Schools have been being run through online for the last 4 months, and some children haven't been able to benefit from that in the way that they could and should, and I think that's something that we really need to push on as a priority for the borough. And active travel I've already mentioned. So I think there's a lot in there. That's a huge workload for a small council, and there's no way that we can do that on our own. So the Making It Happen section of the report really focuses on how we do need to work in a really radically different way across all of our organisations, whether it's private, whether it's public, whether it's third sector, whether it's our residents themselves, to really start to put those things into action and transform our borough for the better, so that we do start to tackle some of those underlying inequalities and poverty issues. So I think back to our values really, and out of our 5 values, I think the community focus in terms of really putting our residents at the heart of what we do is critical, and it does need to be about enabling our residents to fulfill their dreams and their aspirations and reach their full potential and thrive. And the other part of that is our team. And I think we need to start working in a really different way. So it doesn't matter what it says on the lanyard around our necks. Everybody that works in Barrow works for Barrow, and we need to work together collectively across the whole system to make sure that we're all working the best for our borough. So I'm going to pause there for a minute. If anybody's got any questions on any part of the report, then I'll come to those now and then pass back to the chair to go through the recommendations. And if you want me to just keep on going, Derek.
Councillor Hall had his hand up.
Yeah, hi Sam, great report. I've got a couple of observations and a couple of queries. Very first one being on section 1.1, where as a compassionate, it reads, as the last line reads, as a compassionate council are committed to putting our residents at the centre of all we do. I think we should actually say putting our residents and businesses at all we do, because business is key to the future of this town. Do you see that?
Yeah.
Okay. Then if we go down to the exec committee, item 7, it was the additional resources, which it was really just a question around what is the cost commitment there currently going forward, and should that be ring fenced?
I might actually ask Sue to come in on that. The specific resources we're asking for in this plan are some specific gaps that we know that we've got that we need to fill. I think the cost of actually implementing our council plan is a bigger picture that we'll need to come back to, I would imagine, once we've got that fully costed. So I don't know if there's anything you want to add.
Yeah, the commitment, there's a financial section in the report. The commitment here is to external support to move things forward. So it's just 2 specific pieces of work. There's mention also of the community safety partnership, but that's not an additional resource. It's recognising there is a resource. It's a redirected, repurposed resource rather than a new pot of money. So it is just using the transformation reserve for one-off external support as part of this report as a commitment. That's all.
Right, but and what is the amount? That's all, really.
Oh, well, we don't know. We have to procure it. Sorry.
Right,
so
okay.
I haven't got the amounts to include in the report today.
Right. Okay. Then if we go over the page 2. Around the lockdown, mate, it was really it was a disruption to staff. What was the actual scale of disruption to staff, and is this still an issue, or has it mainly gone away?
The scale of disruption to staff was that we closed the town hall to all but essential workers. So our business continuity plan identified a number of services that were essential. Actually, quite a lot of them aren't based in the town hall, so keeping the cemetery running and the crematorium running was essential. Keeping waste collection running was essential. Some building control elements and a range of other services. Revs and bends obviously was really important as well. So we had about half a dozen services that we identified as essential, and we needed to keep those running. Everybody else was sent home as we went into lockdown. So as an organisation, we weren't geared up for working from home, so we didn't have the kit that we needed to work from home. We don't have laptops. A lot of people don't have phones, work phones. So we had to quickly purchase quite a significant number of laptops and other software to enable people to carry on working from home. So it was really disruptive. We also, the essential staff that were coming into the town hall needed to be in, we needed to do social distancing within the town hall. So we needed to spread out into other places, and also where we've got small teams that are dependent on specific IT packages, they have to sit in specific offices. They couldn't all sit in the same offices at the same time. So we had to introduce shift patterns. So we changed the way that the town hall was open. So it's now open 7 till 7. And there was a range of other things that we needed to do. Some of our staff who were essential, so some of our customer services staff were actually shielding, so couldn't come into the office, so we had to do redeployment. We had to get people involved in different tasks that wasn't their normal day job, and the staff have been incredibly responsive to that and flexible, and have stepped up and have taken on different roles, which has been great. In terms of does that continue? Yes, it does. We have 260 staff more or less. Most of those are based in the town hall. We had a fire drill on Monday morning, so we all ended up standing out on the courtyard, and there's about 30 people in the town hall.
Right.
So that's what we're working on at the moment. So most people are still home working. We're going to continue home working where we can for the foreseeable future. And we're assessing each room. We're moving office furniture around to make sure that we've got social distancing, and we are reintroducing some officers back into the town hall where they really need to be in the town hall to be able to do their work, even though they weren't in that first tranche of essential workers. But we're seeing this continuing for some time. It'll continue as long as social distancing continues. And actually, there's some really good practice that we've introduced, like flexible working, like having longer ability to work from 7 till 7, like the ability to work from home a couple of days a week. So I'm working from home on a Tuesday and a Thursday, and only come into the office Monday, Wednesday, Friday. And I think we've introduced some really positive working practices, which we'll want to keep anyway. It was something we wanted to move to anyway. It's made us do it a lot quicker than we expected to. But some of that is actually part of where we want to go as an organisation.
So you've introduced flexi time, basically.
We're still going through
the measure of.
A version of, and we're still going through developing the policies, which we'll need to go through with the unions and get that all cleared. But so it's interim at the moment, but we will be looking at formalising some of those policies over the next few months. Yeah.
Yeah, I mean, obviously, flexi time is something that people like, and it's an attraction to vacancies in the council possibly going forward. So it's a good thing. Thank you. Next one I've got is on page 29. It's item 3.14, and it's just around the business grants. I believe the government offered us 16 million initially, didn't they, for the business grants, and we ended up with using about 11 million.
That's a different report, sorry, Councillor.
Sorry?
That's a different report, sorry.
Oh,
Is it?
Page 29 is the next report, I think. Sorry.
3.14 does talk about the business grants, Sue,
yes.
Under prosperity and the amount of businesses that we paid out.
It says over 1,000 organisations. Of around 11 million, but I believe the government offers 16, and that's just because there wasn't a sort of a solid, for want of a better term, database of the firms involved. Have we now got that going forward?
So I think the initial, and Sue again can correct me if I get any of this wrong, but the initial award of 16 million was based on last year's business rate information and NDR information. When they ran the revised figures, it dropped considerably anyway. So we had a number of businesses that weren't businesses anymore. But then also, as we were contacting businesses that the government thought were eligible, they'd stopped trading and not told us they'd stopped trading, or they were a different kind of business, or some of the big nationals like Costa Coffee and M&S and those kind of organisations, they were claiming in one place, so they didn't claim for every branch that they had up and down the country because they're not allowed to do that. So that took a load out as well. So it just kept whittling down as we dug into it more and contacted more and more businesses. So we're now up to, I think we've paid out about 95% of what we think are our eligible businesses. So we're pretty close to spending all of although it's a reduced allocation, all our businesses that did qualify have benefited. Is that all right, Sue? Does that sum it up, more or less?
Yeah, it does. There are also a number of properties that get small business relief that are for personal use, but they were included in the gross number that government used to allocate funding. So we had a huge chunk, 150 or so, that we just couldn't give automatically because they were personal use. But that's right, what Sam's explained. That's the difference between the allocation, just kind of give money out, which is great, but then when we looked at what we had as eligible was lower, and the balance would be paid back.
Okay, and that 5% that's outstanding, is they're being cleared at a slower rate for, I guess, there'll be people not changing addresses and change of ownership and leases, etc. Is that part of the issue?
It is, yeah. We're about 2% to pay out now. There's been a little bit more progress.
All right, good.
And because we're down to so few, we'll be making contact again where we can. And now businesses have returned, I hope we can make that contact. We don't have personal contact details for some businesses, so now they're back at work, you know, opened again. There's a chance we can get in touch with them. Yeah.
And
Okay.
some businesses just didn't want it.
No,
So
that's true.
They didn't claim because they chose not to claim.
Strange.
Mm.
Right, next one is page 15. And it's about the Waterfront Gateway Managed Business Centre. And it's all about for start-up businesses. But my understanding is the European rules specifically exclude new start businesses from locating in the Waterfront Gateway. Is that correct?
Yeah, you're absolutely right, Councillor Hall. It shouldn't say new start-up SMEs. It's yeah, typo.
Right. Yeah, because that's obviously going to restrict us in a few ways.
Yeah.
Not many more, sorry.
That's fine.
3.3, page 16. It's really around the external partners, Langley Chase, etc. Have these been procured competitively?
So Langley Chase is a grant-giving organisation that have given grants, so they're working with us because they've given us money rather than the other way around. And the others haven't been fully procured yet. We're in conversations around what they can support us with, but they are very specialist services which it'd be difficult to procure.
Right, okay, and the sort of, obviously it might be commercially confidential, but is there not a level of expenditure where they would have to be competitively tendered? Or are they below that?
I'm looking at Sue, but Sue can't tell that I'm looking at Sue.
You can kind of tell. Yeah, obviously everything we do, we go through process, but there are times where it's necessary to make a direct award if it is so specialist that you're not going to be able to get that specialism in a competitive way. So it's kind of direct award rather than a competition or a mini competition, you know, if we can. That's done through the scheme of delegation with, you know, in consultation with myself, Sam, and the chair. So there is a process around it. It's a direct award, but there is rigour around it.
So you've got like an industry, you would have a single source contract procedure. You've got a similar type of thing.
Yes, yeah, and it wouldn't be for an ongoing supply. It would be for a piece of work. So it's it'll be done under that. But obviously we're still in the process of discussions, as Sam said.
Right, thank you. And the final one, you'll be pleased to hear, is page 19, 7.1.2. It was the additional support being sought through the big lottery in Langley Chase. I just wonder what are the existing funds for this, and how much are we actually asking for to, you know, to do what we want to do?
So the Langley Chase funding is it's funding for Love Barrow Together. So it's funding going to sector organisations. It's not funding coming to the council.
Yeah.
But we're working with Love Barrow Together to enable, because they're actually trying to do what we're trying to do anyway. So it makes sense to join up. I'm not entirely. I think this is the second year of funding from Langley Chase. I think they got 250,000 over 2 or 3 years. But Langley have also, because they work, the way that they work is they work specifically with about half a dozen places, in Barrow's one of their places. So when coronavirus hit, they offered Love Barrow Together 100,000 of emergency COVID funding, and the Barrow Community Local Resilience Forum have agreed how that 100,000 will be spent over the next 6 months. So it's funding that was already a previous allocation from about 2 years ago, I think. And the big lottery was one of the partners was asked directly by the big lottery to put in a bid for some funding to develop a process of how you work differently with communities in response to coronavirus. And I think we were asking for 50,000, but again, it was something that was led by a partner. So I think that kind of demonstrates how we're working in a really different way now, that these aren't necessarily council owned or council procured services. It's a real collaboration and coalition of different organisations working together for the same aims and the same vision.
Okay, thanks, Sam.
Whoops. Councillor Pemberton had his hand up.
Thank you. Okay. Thank you, Sam. Page 35, actually, 2 points I want to make. Page 35, it says we will work with our waste collection contractor to encourage residents to recycle as much as we can to increase our recycling rates. A lot of plastics, which we are told cannot be recycled, are being recycled by other councils using different recycling plants. This will surely have a detrimental effect on the percentage figure produced, and if it does, can we change it by going to an alternative factory? And the second point really is page 37. You've mentioned it in your report anyway. The council has recently agreed to continue its membership of the Joint Committee with South Lakeland and Lancaster City Councils. In the light of the prediction that climate change will bring a substantial rise in sea levels that will cause continuous land erosion and flooding throughout Morecambe Bay, including our coast road and Ulverston, are we going to continue to agree with this committee's position to support the NTPG company and all the local MPs in their efforts to get the government to give the go-ahead for a tidal gateway which will stop these catastrophes from happening? Or are we going to put our heads in the bay sand, hoping all the climate change is not going to happen? Thank you, Sam.
Yeah, thanks, Councillor Pemberton. In terms of the recycling, I think we are currently working with our contractor, FCC, to look at our recycling rates and look at what we can and can't recycle, and be really clear with our residents about what they can and can't put in their recycling bins in an attempt to increase our recycling rate. And it is confusing and it is different in different boroughs up and down the country, which doesn't make it easy for our residents or any residents really. And I think it's something that we're continuing to work with FCC to make sure that we get that right. In terms of the Bay Tidal Gateway, I think the work with the Joint Committee is looking at how we can go to government with a prosperity strategy to look at how we can increase our productivity, but also protect our environment. All 3 districts have declared a climate emergency. We've all got climate action plans, and we'll be working together to deliver those climate action plans, because obviously the way to stop sea level rising is to get our carbon production under control. So I think we're all working towards those action plans.
Right. Just a point really I was trying to make with the different factories being able to reclaim or recycle different products. If you're going to produce, getting back to what I was talking about earlier in statistics, getting back, if some councils are using factories that recycle more, they will get better percentage returns than what we are if our factory that recycling ours is turning down a lot of the stuff that the residents are putting in the bins. So, you know, could we not just change to a factory that would recycle more products?
Yeah, I think we need to, I think there's more, we'll definitely need to look at it. But I think in terms of, in terms of that climate change target that we just talked about and being net zero by 2037. I think the production and use of plastic in the first place isn't necessarily great for our environment. And what we really should be doing is working with manufacturers to stop wrapping everything in plastic in the first place. There's massive campaigns around single-use plastic, but also a lot of plastics that we think we recycle. The energy consumption in recycling and reusing plastic is enormous. And I think what we really need to be doing is pushing for a reduction in the amount of plastic that we use in our food packaging. And that's probably where we need to be. So actually, we really shouldn't need big recycling bins. I think recycling's where we failed because we've produced all that waste in the first place and we need to reuse it. So I think we need to get upstream a little bit and think about the way that we use natural resources in the first place, which should take all that failure demand out of the system.
All right, thank you very much, Sam.
It's a pleasure.
Leigh. Councillor Roberts.
Thank you, Chair.
I think, yes.
Yeah, thank you. Thanks, Sam. I know this is it's a bit of a grueler for you. To write shorter reports, that's the key. Picked up on a few things which I've sort of picked out of your report. First and foremost, I think with the questions you've had, I think first thing we should say is what an amazing response to the crisis that particularly the council, because that was at the heart of everything that that happened. Also residents in the third sector have been amazing, and the local businesses, even national ones that are based locally, they did react in a positive and a constructive way. But first and foremost, thanks to the council and the council staff. My probably slightly more increased involvement being deputy leader meant I saw a lot of the things that happened, and the report even showed me there was even more that was going on behind the scenes. So thank you very much, and we just want to put that on record. We do appreciate everything, all the challenges and the success so far of dealing with the crisis. One thing I want to say is we need to be mindful of burnout, because a lot of people are working a lot of hours under a lot of pressure, doing incredible work. We need to think of the council staff wellbeing, which I know you are aware of, but we need to make sure we don't burn people out. As regards to the report itself, I think you picked out as well, Colin Cox has highlighted the effect on the deprived areas and people with inequalities, health or wealth. That should focus us on actually addressing those issues more, especially in light of the data. As part of the local LRF, I've witnessed how successful that's been. So I think you're right, we do need to retain and evolve anything that's worked. And that has been a partnership, a coalition. It's been, it shows how beforehand this wouldn't have happened. We'd have had red tape and barriers and processes and funding disputes, and all that went out the window. So that is the new normal we need to actually retain and sort of build on it. So I think that's important. You've mentioned Love Barrow Together, but I don't think you mentioned it enough. Your diagram on page 39, I think, says it all about people at the heart of Barrow, and then Love Barrow Together as a wraparound of that. I think that is very important, because all the other organisations are coming into that. But it's the people at the heart of Barrow in the middle, which I think I disagree with Councillor Hall's comment about putting businesses as well, because that does include businesses, because in my view, and it has actually started as well. Businesses thrive on our people, how our people access the jobs, how our people spend their money locally. The council's engagement with businesses has been better than ever before, and it's increasing all the time. And we've seen that with things like the Town Steel Board and other partnerships, where they're actually involved in helping us deliver our council plan. But they're invested and interested in helping our residents because they know it's beneficial. So I think if you've got loads of businesses in the room and say, what would improve your business? It's sort of what common theme it would be improving the residents' ability to work here, live here, and attract businesses to come here, which is about improving the area. So I think to leave it as people-centred and residents, I think is right. The cost aspect, which you picked up on, I think it's not clear, obviously, that the cost, you can't measure it at the moment, but also the cost won't be our burden. alone. The way we're looking at it, and it's happened even now in the LRF, we're committed to fund some of it, but we won't have to because a lot of the other organisations are already finding grants, have already got money to deliver certain services. We're just knitting it all together and maybe plugging some gaps. So I don't think it's just a one, it's not us anymore, that's the difference. So that will be reflected in the cost. And also, to get sort of mildly political, it will depend on how much we reimbursed for our expenditure on the COVID crisis, because that will have an impact, and it will also depend on what partners will provide. And up to now, partners have been positive and engaged, so I think it'll be quite a positive picture of what other partners and other businesses help us with in delivering that. A couple more points. I think key workers is one of the things which has been highlighted during the crisis, and that includes all the council staff, healthcare workers. So it shows how we should value a different sort of subset of our residents. I think that should continue, and we should make sure that is highlighted in everything we do. People that have actually helped us get through this are the people that we should be valuing a bit more. The medium and long-term recovery, I think the school holidays is important, and the LRF are looking at that. But medium and long term, I think the impact on children at the moment is going to be significant, but it's a bit hidden at the moment, which Sam did allude to. So that's something we need to focus on as a medium and long term, because that'll be very, very important for families, for their mental health and well-being, as well as the physical health. Safeguarding for children, but also domestic violence is going to be a big issue, because the underreporting of that doesn't mean it's not there. So I think there's a load of strands we need to actually capture here. And I think this report is actually pulling it all together with other partners. So the onus isn't just on us. It's the responsibility is on us to make sure we're seeing a need and something is done about it, but it's not always us that's doing it. We're making sure it happens and knitting it together. That's how I read this report. And I think it's actually exciting, and it's positive, and it's encouraging. The final point on spending money on other partners, some of the people that have become interested in Barrow and involved so now, they're nationally and sometimes internationally renowned. We should be welcoming with open arms. It doesn't mean we're spending money. It means we're engaging with some high level exciting partners like the Hilary Cottams and the Cormac Russells and some of the Lankelly. They're investing in areas because they see a problem. It fits in with their ambition. So I think it's something to be proud of, that they're interested in us and what we could do. So although we'll be careful with public money as ever before, we should be actually very excited about some of the people who are wanting to help us deliver our council plan. Thank you.
Thanks, Lee. I think they were statements rather than questions, so I won't respond to that. But
Yeah.
Thanks for the thanks.
Councillor Hall, is that you again? Now then, don't go over your limit.
You get me there, Rick, as well.
Go on.
Councillor Hall, you just need to mute yourself.
You're on.
Actually, Councillor Roberts covered it, so we can take me on down.
Right. Have we finished on that one?
No,
Have we got?
I keep waving my hand and jumping up in the head.
Sorry?
Headbutting the wall. I'm just reading it. Borough Council response to coronavirus. I don't think we've gone far enough. I had a local committee yesterday, and we had the actual figures down. How many food parcels went out? Not just from the joint. Absolutely, you're completely 100% right. A different way of working. Forget the red tape. Let's get together and help the community of Barrow-in-Furness. Forget about the cost or whatever. With people dying, 60 people dying and whatever, we can look at that after. The medicine that went out, the food parcels went out, the volunteers, absolutely wonderful. And that's the part that's missing, excuse me, that's the part that's missing in there. And you're going about the generic working and whatever. How many people did the homeless people, how many people applied, and how many this, just to get the true story behind the scenes, like some of the staff working all over the place. I know I've been evicted, ostracised from the town hall. Yeah. But to see what's actually taking place and just to talking to people, and it's there, absolutely unbelievable. What I would like to make a recommendation, Chair, through you, because in the local committee yesterday, we actually included Barrowborough Council, Cumbria County Council, so it's committed working in the true partnership. So when we go to the government again, so when it records its thanks for the work of organisations, could possibly Cumbria County Council area support team and organisations. So we got a true record there of the councils being together in a true partnership to face anything else that's going is in case we go on for financial money or whatever. Do you not think? I'm waiting for somebody.
If I just
anyone?
jump in first, I think it's up to you as a committee if you want to change the recommendation when we get to the recommendations. But yeah, thanks for that, Kevin. And I apologise for personally evicting you from the town hall on a number of occasions, but it is still closed to councillors. I'm really sorry.
All right.
And in terms of the facts and figures, we were trying to put more facts and figures into this report, but I think that we're still getting a lot of that data back. And if the area committee have already started to get some of that data back, then that's great, and we can capture that and make sure we get that going forward. So one of the things that we do want to do with this information in this report is make sure that we capture all of those stats around, how many people we've supported who presented as homeless, the amount of support that we gave through the LRF, the tonnage of additional waste we collected that had been fly tipped. All that information, we're still trying to pull that together and work it into an infographic so that we can go out and say these are all the things that the council did for the borough.
Story.
So yeah, we are working on that, Kevin. We just didn't have all that information to hand in time for this report.
Thank you.
Anybody else?
Councillor Morgan, Chair.
Oh, go on.
Yeah, thank you. I know we're probably about to go into the recommendations, and the first recommendation is about thanking the frontline staff, and I think Sam has made it really clear about how the staff have responded to the crisis and the agile working and the creative ways that they've worked and how they've worked in areas that they've never worked in before, and for the, right back to we are going to support our residents. What isn't included in the recommendations is a thanks for Sam, and I think that we should thank her for a kind of calm leadership in a crisis, because it doesn't specifically mention Sam, and I think as an executive committee, I think that would be quite nice to note, if that's okay. That's me.
Oh, you've all made it too complicated now. I was just going to move the recommendations. It's too hard now. Have we got any more comments? Right, I'm not sure how to do this now then. Recommended. John, have you got a note of these additional things?
Yeah,
we could just include in it.
Yes, we can include regarding Sam, Chief Executive, put that in. And also in number 2 about the County Council support, we'll include that as well if you wish.
Okay. Is that all right with everyone then? I don't have to read all these out, do I? We've all got them.
We do need to move and seconder, please.
Before you do, I'm really sorry. Thank you very much. Thanks, Bev. But it definitely was a team effort. And if we're going to thank me, then I think it needs to be my management team, because we've all worked our socks off for the last 4 months.
I agree. I think that would be an excellent recommendation. Brilliant.
Right. So have we got all that down, John?
Yes. Can we have a mover and seconder, please, with the recommendations as amended?
I'll move it. Councillor Barlow.
Seconder?
Second it.
Councillor Maddox, right. Do we have to do a roll call thing now?
Yes, we do, Chair.
Oh, damn.
So the motion has been moved by Councillor Barlow and seconded by Councillor Maddox. Please, can you say for, against, or abstain? Councillor Barlow.
For.
Councillor Biggins.
For.
Councillor Blessard. Councillor Blessard.
Where is he? Oh, he's gone.
Oh,
Is he?
I'll move past Councillor Blessard then. Councillor Brooke.
For.
Councillor Hall.
For.
Councillor Hamilton.
For.
Councillor McClure.
For.
Councillor Maddox.
for.
Councillor Morgan.
For.
Councillor Pemberton.
For.
Councillor Roberts. Councillor Roberts.
He's frozen.
For.
Oh,
Thank you. Councillor Ronson.
For.
Thank you. That's unanimous.
right. Right, what are we on to now then? I guess we must be on to 11. Right. Do we need, Sean didn't say he was going. Do we need to check out that he's not accidentally left or what? Or do we just carry on? Just carry on.
If you wish to adjourn for 10 minutes, it's up to you, Chair, or we can just carry on.
It looks like
Carry on.
Councillor Roberts has dropped off as well, so we might be having a few connection issues. I can't.
Yeah.
The screen just moved like we'd just lost a couple of
Well, Lee froze on it and then he's
gone.
He's gone. I can't imagine he would have gone on purpose without telling us. Can we have a 10-minute break then and return at 10 to 4?
Yeah.
Is that okay?
Yeah. Thank you.
Are we live again? Right, sorry about the slight delay. I had a few technical issues there, but we're back again with agenda item 11, COVID discretionary business support grants, and I'll hand over to Sue Roberts.
Thank you, Chair. Yeah, the members will be aware of what we've done with business grants. It's been there's I think Sean's coming back. No, yeah, no, sorry, I'll carry on. So yeah, there was the.
Let him in,
is it? Yeah.
Welcome back, Sean.
Hello.
Yeah, sorry about that. I got thrown off and had to
right, we're live again.
It's still unstable, it says. I've rebooted, but if I go again, it's for the same problem. Sorry.
Okay.
Okay, we just started again, Sean.
Question for Colin then, and 47 questions for Sam.
Too late.
So the members will be aware there was the business grant support that was under what we call an original set of schemes that were small business, retail, hospitality and leisure. Then beginning of May, an allowance from the grant that was originally given was permitted for each authority, it's about 5%, to use for discretionary business grants. There were still certain criteria that had to be fulfilled. It is aimed at small and micro businesses. So this report now is, as I said, we flagged it through, sort of communicate what we were doing along the way, but this is kind of to formally bring the scheme that we've operated to members. The scheme is cash limited. It is at 5%. There's no top up from government, unlike the original schemes where if you spend more you can have more. We are cash limited. The scheme's appended. We have completed round 1 of these grants and we awarded 61 grants with a total of 280,000. So there will be a round 2. And I'm reviewing the scheme at the moment to see if there's any way we can, we want to incorporate or cover those businesses that we can, so as much as we can, but we still have those national rules to comply with. But say we will be going again. I think the area where there is some flexibility for us to review is around the rateable value. So we'll be doing some modelling and then reopening the scheme. But I said this is for noting, members were aware of the scheme and that we were running it anyway. So I won't go into the detail of the scheme. It is exactly what we sent out before we opened it up. But before we do the next launch, which will be sometime next week, we'll send details of those changes so you can communicate those to anybody that gets in touch with you. Thank you, Chair.
Right, thanks. Councillor Hall.
Yeah, thanks for those figures. The 61 awards,
yeah.
How many were actually rejected and deferred from the applications?
Well, we had 154 in total, so that's 93 with my maths work that were ineligible, but they were ineligible for various reasons. Sometimes it was the information that we needed, which is set out in the application, wasn't provided, and we gave an extended 5 to 7 days to provide that to each business. So each one was contacted. That we had a team of staff volunteered to be the comms team for that process. So they kind of looked after a certain number of businesses each, and we're very specific about what we needed to see. But we did have to have a cut-off, a deadline for that. But we did that 5 to 7 days extra. So if they have that information, they could apply in round 2. But we had other applications where the rateable value was over the maximum within the scheme. There were various reasons why we couldn't fund some, but a lot of it was down to information not provided, so we couldn't make an assessment. And they say we did that extra chasing, but we had to come to a conclusion to be able to pay, because it's cash limited. You kind of have to get to the end of your assessment and then go through your criteria. So that's what we've done with round 1. So that will be repeated for round 2, but hopefully opening it up as much as we can within the rules that we've got will encourage more applications. But yeah, the total to start with was 154, but only 61, but 61 got funding.
Yeah. And have you actually set the dates for round 2 to be opened?
I'm hoping for next Wednesday. I just need to revisit all the documentation because there's changing the scheme changes the application slightly. So that's all being done. I want to get the sort of the comms part of it lined up as well. So I'm hoping for next Wednesday.
Right, thank you.
Nobody else? We all okay with that? Do we have to have it? We don't have. Do we agree with the recommendations?
Excuse me, Chair.
Yeah.
Thinking about it, through the Sue will know any road, through the discretionary grants, our community centre got something, so, and I'm the treasurer, so I just thought I'd let you know. And John, if I've got to declare an interest, I'll have to sign a form at the end of this when we're finished.
Right. Okay. We agreed the report. We don't have to go around and do a roll call, do we, John? No? We agreed the recommendation. It's just to note the report.
Agreed.
Great.
Right, thank you.
Agreed.
Right, next one is item 12, establishing a hardship fund again. Back to Sue.
Thank you, Chair. Another COVID-related report. This is it follows on from a report I brought last time around the hardship fund, which was awarded to each council, primarily to give council tax relief. As I explained last time, we have 100% funded. 100%. I don't mean funded, but if someone applies for council tax support from a council in Cumbria, they can get up to 100% support, where in other areas authorities have chosen to design schemes that only maybe cover 95% of support, so there's always a shortfall. So the distribution of funding was based on the assumption that most authorities passed some cost on to council taxpayers. With that not being the case for us, the amount of money we were given were unlikely to award all of that in council tax relief. The award is capped at 300, so there's been quite a lot of modelling done so that taking some of that pot for local welfare, which the grant allocation allows, will leave enough there for council tax relief for the rest of this year. So in essence, this is setting up a fund for local welfare support, and I've identified 250,000 as that pot. As mentioned at the last meeting, the hardship fund awards will be monitored and reported in quarterly. So if it looks like we're not going to spend more of the fund on council tax relief, then I see it moving into this local welfare support pot. So to administer that pot does need some decisions from members. So I'm recommending that the award of that funding is delegated to me with a working group of members for me to consult with. There are some particular issues I've mentioned in the report. Apologies for keeping on turning sideways. I'm reading my bit of paper at the side. So I've explained in the report where the funding's come from, and the way that we see that working is the Barrow Community Local Resilience Forum. They've done a lot of work already and continue to work in the community, so they understand the needs and the demands that something like this pot could be used to meet. And it wouldn't be that the council directly had a lot of small transactions. It would be looking for some kind of collaborative bid to fund, so that it would be that joined up approach that already exists. The council's able to complement that and not create anything new. And that collaboration is already community services that are already working together. So it's really kind of just adding to rather than creating anything again from scratch. I've listed in the report some things that the funds could be used for. It's not an exclusive list. It's just to give an idea of what is meant by local welfare support within the grant terminology. I've drawn out particularly it's been mentioned before, so I won't go over it again, but there's summer holidays coming up. There's not going to be as much going on. There isn't going to be the same network of friends and family to use for childcare and child support, and even just kids to play together. That's going to be very different. So I'd see that as quite an urgent need. So that in a way is kind of setting the first agenda, but this pot has to be spent in the year, and I think to sort of say give us a plan for everything is too much. We need to do it in stages. So the school summer holidays are kind of the initial piece of work that needs to be done, and that would be with the Barrow Community LRF and the working group and the collaborative partnership that's going to deliver that for us. I think there is a lead within that organisation anyway, within that structure. And then we'd need to look at what happens with the rest of it, the rest of that funding. I do mention the community hubs in the report because you know, the council sees the benefit, the value of those, and is committed to seeing those continue beyond their current funding stream. There's no kind of assumptions within this report of how that actually happens, but it is worth recognising that model is proving to work and have a positive impact. I've set out the terms of reference, if you want to call them, of the working group. It's not a subcommittee, but it does still need some structure. So I've used terms of reference document for members to understand what exactly how that would work. So I think that's it really, in essence, what we're looking at doing. It could have real benefits, and if we don't use this money, it's going to go back. We're not going to use it all on council tax relief. There might be some more, but this is the best way to deal with it, in my view. So that's it. Any questions?
Right. Have we got any questions from anyone?
Yeah, Brother Chair, is you looking at the members to be nominated today? From the...
Doesn't have to stay, Councillor. No, you can let me know afterwards. If,
okay.
Yeah, fine either way.
But you need to get that in place fairly soon, don't you?
Oh yes, yeah. I was thinking tomorrow if you.
Yeah, that's fine. No.
Yeah, the summer holidays. I mean, with my other hat, my previous hats on, all sorts of things I would have been in the past helping organise for the summer holidays. It's not happening. So, you know, we need to be creative. And I know the Resilience Hub have been sending out emails to potential providers and trying to put a plan together. So it makes much more sense to do it this way than receive lots of applications for £1,000 and £2,000 here and there. So we just need to get a move on it. And it's not normal, but you know, we're responding collectively with our community, and what else can we do? So,
Derek, do you know if the Resilience Hubs have been in touch with Drop Zone about perhaps provision over the summer?
They've sent out to all the providers, as far as I know. Yeah, Lee's gonna. Right. Lee?
Drop Zone are part of the LRF. Cascorcle's on the LRF. Yeah. So all the partners are actually part of the LRF. So that's why the model should work, because all the ones that would be delivering stuff, schemes and initiatives during the summer are actually in a partnership now. So it's worth saying that this fund will be filling the gaps. It won't be totally funding a programme of work. It'll be knitting together the programmes of work that are already there and funded, maybe widening them out or putting them in more areas. And it'll be plugging the gaps where there's a shortfall in either an emergent need due to the crisis or something we can highlight using the talent and the scope of the team. So yeah, Drop Zone are deeply and heavily involved.
Yeah, so I would just add that if that structure didn't exist, we would be struggling to do local welfare support. We'd have to set something up from scratch. So it's really fortuitous that that's there, and that is something we can drop money into. You know, there'll be a structure, there'll be a proposal that we know what we're buying in effect, but the money's got to get out there, and I see that as the quickest way, rather than sitting around for another 9 months waiting to see if hardship claims come in, because I say they're more likely to receive full council tax support than need the hardship fund.
Right, can we agree do I have to go through these recommendations one by one, or can we just, do we agree the recommendation?
We need a mover and seconder, please.
Somebody move it, please.
I'll move it, Chair.
I'll second it.
Seconded.
Yep.
Do we have to do the?
Yes, we do, Chair.
Do we? Okay, go on then.
It's been moved by Councillor Hamilton, seconded by Councillor Roberts. Could you indicate for, against, or abstain? Councillor Barlow.
For, John, unmuted.
Biggins.
For.
Blizzard.
For.
Brooke.
For.
Paul.
For.
Hamilton.
For.
McClure. Maddox. Hamilton. Councillor Pemberton.
Sorry, for.
Roberts.
For.
Ronson. That's carried unanimously. Thank you.
So Les, you're going to tell Sam tomorrow who your representative. Les?
Yes, I'll email it tonight, Derek.
Okay, thank you. Right, next one. Where are we? A non-COVID item. Item 13. Sandra Baines, Forum Manager, will present us a report on the catering and cleaning contract. Ta-da! It's over to you, Sandra.
Thank you. The catering contract went out to tender in February of this year, and due to COVID, we extended the submission deadline to April, and we went through evaluation process, and this report really is asking for the committee to approve that contractor 3 be awarded the contract. I hope, as everybody read the report, is there any questions on the report that you'd like me to clarify?
Has anybody got any questions? I know members were involved in putting together new criteria for going out to tender, so we can use the town hall separately and stuff, but for weddings and stuff. So, sorry, Councillor Blizzard first, and then Councillor Pemberton.
Yeah, just on that, Chair, that I chaired the meetings of looking at the contract, and I think it's really good. We've got some really good solid things in there that help us move forward as a council. I think it's a good contract. The staff worked really hard on it. The members all had a good input in it, and things like moving the unlinking the town hall away from the forum catering contract just means things like weddings going forward will be much more achievable. So I think it's a really good way forward for the council, and yeah, I think everyone just worked really hard on it. So just to flag that up and thank everyone involved.
Okay.
Right, cheers. Councillor Pemberton. You're still muted, Alan.
Sorry. Thanks, Chair. I must first of all say I agree with the contract. Just that Appendix 1 did test my eyesight. I went get not only glasses but a microscope. So thank you very much anyway.
Yeah, I know. I kind of noticed that as well, but never mind. We're okay. Are we all? Anybody else want to say anything? Are we all?
No, we need to move and seconder, please.
Somebody going to move it?
I'll move it.
Councillor Blizzard's moved it. Seconded.
Second it.
Councillor Hamilton seconded.
Okay, thank you. The motion has been moved by Councillor Blizzard and seconded by Councillor Hamilton. Please reply with for, against or abstain. Councillors Barlow. Sounded like a rap.
It's 4.
4. That's a 4. All the way from Walney.
Councillor
There's only 3 tenderers.
Councillor Biggins.
4.
Blizzard.
4.
Brooke.
4.
Paul.
4.
Hamilton.
4.
McClure. Maddock.
4.
Pemberton.
4.
Roberts.
4.
Ronson.
4.
That's unanimous, Chair. Thank you.
See, we're all getting the hang of this unmuting stuff now, and we'll all be able to do it properly when we go back to having normal real meetings in person. So what's next? Let's have a look. Planning performance agreements. Jason, item 14, please.
Thank you very much, Chair. I think before I go into some of the salient points on the report, I'll just give a bit of background to this. There are probably three main elements. Firstly, the planning section, whilst being very experienced, is quite small in terms of numbers, so there's a potential resource issue there. Secondly, we have an up-to-date development plan. There are a number of large sites that have been allocated for various potential uses, commercial, residential, mixed, etc. And I'm thinking of Marina Village, Salthouse Mills, Waterfront Business Park, plus any windfall applications of a sizable nature that could come in from Kimberley Clark, BAE, or the vacant Robert McBride site, for example. Thirdly, planning applications are not getting any simpler, quite the reverse. They're getting quite complicated. There are additional layers of environmental legislation, ecological issues, biodiversity, climate change that all have to be taken into account. If we get a large, complex application, then collectively, those three elements I've discussed are potentially going to cause us some serious issues. The first side is going to be that I'm going to have at least one, potentially two members of staff diverted from their mainstream duties. So we may well get a backlog of applications. Secondly, we'll end up having to buy in expertise, and that's not cheap, whether it's ecology, heritage, transport, whatever. And thirdly, as a result, we will end up struggling to meet the government's targets on determination. And one of the ways that we can resolve this matter is through planning performance agreements or PPAs. Now, they're described in the report. They are a project management tool. They're based around a legal framework, if you like, which is signed by the local planning authority, by the applicant, and possibly by third parties, which could be a statutory consultee, such as the county, for example. And they normally would cover all the stages of an application. So we'll be talking about the pre-application stage, the actual application itself, and afterwards in terms of monitoring conditions and discharging conditions. In terms of advantages, one of the main advantages is that they do identify what the issues are. And it allows us to establish the resources that are going to be needed. Now, basically it's going to identify any abnormal costs, for example, from having to buy in expertise. We may have to buy in agency staff to fill the gaps of the planning officers who are working on the big application. Now, with a planning performance agreement, those costs will be met by the applicant. So there's no cost to the borrower in that respect. This enables all parties also to agree a timetable, milestones, if you like, as to when we will move the whole application forward. It enables a much better governance of the whole process. We have better communication, we have better information supplied, and it should result in much higher quality developments. That's the first thing. It also helps us to effectively deliver some of the council's priorities. One thing I must say is that it doesn't guarantee planning permission. You can't buy planning approval. The application will still be determined in accordance with its planning merits. So the recommendation is that the relevant officers are given delegated power to be able to enter into and negotiate planning performance agreements with applicants if they should wish to do so. And I'm happy to take any questions.
Okay, thanks, Jason. Les?
Yeah, thanks, Jason. Jason, what's the sort of cost benefit to the council? Can you put a figure on it if we enter into this?
In terms of cost benefit, there were a number of applications over the past 3 years where we've had to put them out to consultants because we just didn't have the capacity, particularly when we were dealing with successor applications. And you're looking between £5,000 to £10,000 per application to be dealt with by consultants. And that does come out of our budget. Now, if we have a PPA, then those sort of costs are paid for by the applicant. So there's an instant benefit there. And also the hidden benefits in terms of we're likely to get better and quicker decisions and better development.
Right. So, but the actual planning process is still fully gone through. It's not a shortcut there.
It's not a shortcut at all. As I said, just because an applicant enters into PPA doesn't automatically mean at the end of the day they'll get consent.
Mm-hmm.
It has to go through the correct governance procedures.
Right. Okay, thank you.
Okay. Any more? Okay, seems like a positive proposal to me. And as Jason kept saying, you still can't buy planning approval if you're watching on YouTube. Still got to go through the proper process. Right, where's my little crib sheet? Let's have a look. Right, do we have a mover for the proposal that we adopt this?
Move it.
I'll second it.
Seconded, right. Do we need to take a vote? I guess we need to take a vote again.
Yes, please.
Yeah, go on
The
then.
motion's been moved by Councillor Barlow and seconded by Councillor Hall. Please could you indicate either for, against or abstain? Councillors Barlow.
For.
Biggins.
For.
Lazard.
For.
Brooke.
For.
Hall.
For.
Hamilton.
For.
McClure. Maddox. Pemberton.
For.
Roberts. Bronson.
For.
That's unanimous, Chair.
Right, thank you. And where are we now? 15. Janice has gone. Let's have a look. What am I doing? Right, Caroline, are you doing the 15?
I am, Chair. I haven't got the agenda. I think Jan's took that. So was it CBL first, Cumbria Choice, or was it right of succession?
Cumbria Choice first, yeah.
Yeah, okay. Members will be aware of the Cumbria Choice allocations policy, which is how we allocate properties across Cumbria. There's the 6 district councils and the 7 RSLs within the partnership. This policy is a review of the existing policy, and the reason behind it is due to changes in legislation. Predominantly within that is the Homeless Reduction Act, which is a massive piece of legislation that saw key changes for homelessness. So it's to ensure really that it's fair to all the categories across that legislation. So when looking at the policy, the aim of it is to ensure that it's fair, transparent and accountable across Cumbria, being consistent as well, so that applicants, whether you apply from each of the district councils or the RSLs, it's all with one policy. And it also makes it easier if we have to move applicants across districts. That's particularly relevant if it's a domestic abuse case,
that they're needing to move out of town. It gives us more fluidity to be able to do that at speed and efficiently and protect vulnerable applicants. So one of the things with the changes, I think at pre-agenda, it was asked if I could simplify it because it is a very lengthy document, as you can imagine. The policy is 46 pages, and then we've got an operating guide for staff as well. So to narrow it down and to give you it in brief, we did have 5 bands within Cumbria Choice, and we've now narrowed it down to 3. The review of the policy project board for Cumbria Choice subbed that out to an expert consultant, Andy Gale, who has worked for the MCHLG. So he is an expert in his field. So he's looked across all the legislation, and we've narrowed it down to 3 bands, A, B and C. So A is for the most urgent need. So when we're looking at that as an example, it could be a client bed blocking in hospital that we need to move on. It could be a domestic abuse case. It could be a case that we are working with under MAPA regulations to ensure public safety. So they are the kind of groups that will be in Band A. For Band B, predominantly a lot of the clients in that will be homeless applicants that we are looking at under prevention and relief status. So that is to prevent the homelessness, and if they are homeless, relieve it. So that's to give them extra priority. And Band C is everybody else that's in there. So it is to give greater clarity. We have got an open register so that anybody can apply. There is qualification rules that have been amended in that. And really that is around former tenant arrears. So if applicants have been with one of the organisations and have run up huge debt, there is a qualification criteria around that, and also antisocial behaviour. If we've had to look at getting injunctions or evictions for antisocial behaviour, it does give greater clarity around that. It's not to say that we won't ever house somebody that's in them situations, but it is to give greater clarity and reasoning around that, especially for the applicant, so that they can understand what they need to do to resolve their situation and help them back into social housing. Just to note that obviously it is a county document, so this has to go through all the different boards of the RSLs and also the councils across all the districts. So within the recommendations, you'll see one of the areas is to delegate authority to the Assistant Director of Housing, which is Jan Sharp, to approve any minor amendments that might come out of this, just doing the approval process of partner organisations. I hope that's simplified it down and give you an understanding of it. Is there any questions before I ask the Chair to agree that everyone's happy with the recommendations?
Right, we're all okay with that. Thanks. Do we need a roll call again?
Yes, can we have a move and seconder, please?
Move the recommendations, Chair.
I'll second them.
I'll second it, John.
Thank you. The motion has been moved by Councillor Hamilton, seconded by Councillor Barlow. Please reply with for, against or abstain. Councillors Barlow. Councillor Barlow.
Oh.
Biggins.
4.
Blizzard.
4.
Brooke.
4.
Paul.
4.
Hamilton.
4.
McClure. Maddox.
4.
Pemberton.
4.
Roberts.
4.
Ronson. Councillor Ronson.
4.
Thank you. That's carried unanimously, Chair.
Okay.
Right, now then, I think we're actually on to the last item. Good job I haven't got a football match to go to with 4:30. Goodness me. Right, item 16, right of succession policy review. It's another housing item. Last one.
Thank you, Chair. Yeah, right of succession policy, again, is another reviewed policy within housing. And again, this is around updates in legislation to ensure that the legalities around succeeding a tenancy apply. We have had specialist housing solicitors look through the policy and procedures to ensure legally that it is correct. And the operating guide for staff within the procedure, we have got the relevant forms and templates for staff to use to ensure legally we're watertight with it. Again, when I did it at pre-agenda, because it is quite a legal document with a lot of legislation behind it, I was asked to simplify it. So the procedure really deals with 3 situations in terms of right of succession. So it is the death of a joint tenant, a request made to succeed a tenancy by either husband, wife, civil partner, or a person living with the deceased as a partner, and a request to succeed by a family member living with the deceased. Under statute law, there can only be one right of succession to a tenancy, so that it is within the procedures. The council has absolute discretion to consider all of the above, but whilst we're looking at it, we do have to make reference and consider other aspects that we work with. And one is the Cumbria Choice Allocations Policy, the demand for housing on our stock and supply that we have, the behaviour of individuals requesting to succeed, and with that I mean again around antisocial behaviour, if they're causing serious ASB to residents, the size and suitability of the property. It might be that they're under occupying, they could be overcrowded, or it could be one that needs adaptations or not needing adaptations, and the length of time that somebody's lived there as the principal home. So the right to succeed can be reviewed by a senior officer. Somebody can ask for it to be reviewed in terms of the way the process has been followed, but if there has been a right to succeed already, that cannot be reviewed because there can only be one right of succession to a tenancy. So with that, I have made the recommendations on it. Is there any questions around it? It's quite a lengthy document again, but it should give greater clarity to staff and anyone asking for a succession.
Any questions, anyone?
Move the recommendations, Chair.
Seconded anywhere?
I'll second it.
Right, we okay then? You're going to do it again, John?
Yes, thanks, Chair. The motion has been moved by Councillor Hamilton, seconded by Councillor Maddox. Please reply with for, against or abstain. Councillors Barlow.
For.
Biggins.
For.
Lazard.
For.
Brooke.
For.
Paul.
For.
Hamilton.
For.
McClure. Maddox.
For.
Pemberton.
For.
Roberts. Ronson.
For.
That's unanimous. Thank you, Chairman.
So have we actually finished then? Have we?
That's a meeting.
We have, haven't we? We finished. Yes. Right. Well, thank you all for coming. For those millions watching on YouTube, I hope you all enjoyed it. And I'll see you all again for our next executive meeting later on in the month. And for everybody else, thank you very much. I think that was pretty good. Minor hiccup with our IT halfway through for a couple of minutes, and that was it. So that's it. Can we close down now?